Medicare mandatory? Well, with all things Social Security, Medicare, I guess the government, it depends. It depends on your particular situation. So we're going to go over all those particular situations today, whether you should be paying it, if you're wasting money paying your Medicare Part B, Part D, Part A, whatever the case may be. We're going to get into all those situations. A lot of people out there are paying for it and they shouldn't. A lot of people are paying for it and they should perhaps have other agencies pay for it, and there's other help out there for those people out there struggling. So I'll get into all of the situations for people paying into Medicare once they start their Medicare at 65 or they became disabled. So for Medicare Part A, Part B, Part C, Part D, all the rest of it, you're eligible for that once you're eligible for Medicare at 65, or you're disabled, receiving SSDI, not SSI, not Supplemental Security Income, the welfare-based program Social Security administers. That's Supplemental Security Income. People think it means Social Security income. No, it's a different program. You don't get Medicare based on SSI, but you do get it on SSDI. Okay, let's get into it, and then we will get into some of your questions. We also got some questions on DAC benefits, disabled adult child benefits, and whether they're should be receiving Medicare, Medi-Cal, Medicaid. We'll get into that. If you've got any questions, make sure you type them in there. All right. So is Medicare mandatory? So Medicare is made up several parts. There's Part A, Part B, Part C. I don't like it calling Part C, but people call it Part C, and then Part D. And then you have those Medicare supplement plans, also called Medigap plans. The whole thing is way, way too confusing. That's why most of our members in our community think we should move to a Medicare for all system, but that's an issue that we're going to have to work out as an American public. But Medicare Part A covers your hospitalization. And most people, yes, there's some people that pay for Medicare Part A, but most people, 99% of people, do not pay a monthly premium for Part A. You pay for it. All those decades you worked and paid FICA taxes. Your FICA taxes is part of that is Social Security tax, 6.2%. Your employer pays the other 6.2%. And then you have Medicare tax, 1.45%. And then your employer pays the other 1.45%. And then there's also, if you're a highway journey, you pay a little bit more. But you already paid for Part A when you were working. So once you sign up for it, let's say at 65, there is no monthly premium for Part A. I don't want to say it's free because you already pay for it. It's zero premium once you start it. Is it mandatory? It depends. This is the one that is definitely mandatory if you're currently receiving Social Security benefits. Once you start your Social Security benefits and you turn 65, you have to sign up for Part A, okay? Because that's just the way it is. Unless the exception, with everything Social Security, there's exceptions, the exceptions, exceptions. If you are paying a premium for your Part A, then you don't have to sign up for Part A at 65, okay? So if you are receiving your Social Security benefits, let's say at 62 years old, and all of a sudden you turn 65, they will send you a card. Medicare will send you your card with your Part A and Part B. You can refuse Part B. That's what covers the doctors, the outpatient, the medical part of it. That for this year is $185. Next year, it's $202.90. You can refuse Part B, but you cannot refuse Part A if it's zero premium to you. Okay? And we'll talk about when you can and whether you should and all the rest here in a little bit. Okay. So you can refuse Part B if you have what's called creditable coverage, and I'll get to that in a little bit. Part C, those are those Medicare Advantage plans out there. I don't like calling it Part C because it makes it sound like it's part of original Medicare. It's not. You're essentially giving up original Medicare to get a privatized Medicare plan, but they call it Part C. And then the Part D is the prescription drug program, Part D prescription drugs. And if you don't sign up for Part B and Part D when you're supposed to, as we used to say in the Marine Corps, nothing is mandatory in life, but the repercussions are, in this case, penalties. If you don't sign up for Part B when you're supposed to, whether you're 24 months on disability or you turn 65, if you don't sign up that time, you choose not to sign up for Part B and Part D, then you're going to be penalized for the rest of your life. For Part B, it's 10% for every 12 months you did not have it. For Part D, it's a little bit more complicated. It's 1% per month. 1% of what? It's 1% of the average national price of a Part D plan. For Part B, it's easy. It's 10% of the monthly premium. So if the monthly premium this year is $185, you're going to pay another $18.50 every single month for the rest of your life. If you miss 10 years, you're going to pay 100%. So you're going to pay $185 times 2 every single month for the rest of your life. And people used to come into the Social Security Administration and say, I don't want Medicare. I'm healthy. I don't need health insurance. And so they say, why are you penalizing me? I didn't want it. I don't want to save, they're saying, well, I don't want to use Medicare and I'm actually saving the government money by not using it. So why are you forcing me to do it? I've heard that hundreds of thousands of times over the decades working at Social Security. And the reason is because just like Medicare is an insurance, just like every insurance, auto insurance, I don't intend on having an accident today, knock on wood. Why do I have to pay auto insurance? Because somebody is going to have an accident today and it's a pooled risk. So one day, hopefully it never happens to you. Hopefully you pay your car insurance for 80 years, millions of dollars, and hopefully you never have to use it. So you've just wasted millions of dollars throughout your life. But that's unfortunately how insurance works. It's a pooled risk. So you have to get it even if you're not going to use it, because your premium pays for all those other people using it. Okay, so when don't you have to sign up? If you have what's called creditable coverage, you do not have to sign up for Part B. So let's say you're 65 years old, about 100 days before you turn 65, they will mail you your Medicare card, Part A, Part B. And again, you cannot refuse Part A, that's zero premium, but you can refuse Part B and save yourself the $185 or $202.90 a month. And it'll give you instructions. Medicare has instructions, you return the card and all that stuff. So, but you can only do that and avoid the penalties if you have creditable coverage. What's creditable coverage? Creditable coverage is you had health insurance from work, current work, not a retirement plan. Someone says, I'll just stick with the Affordable Care Act. You can. The Affordable Care Act is not creditable coverage. Veterans Administration is not creditable coverage for Part B. If you technically can keep the Affordable Care Act marketplace insurance past 65, but you lose all the subsidies and all the cost sharing. So that's why most people, almost everybody, once they turn 65, they switch over to Medicare. And it's the $185, $202.90, whatever the case may be. But considering the prices of the Affordable Care Act for 2026, your prices are going to go up probably 100, 200, 300% there. So you can technically keep the Affordable Care Act, but again, you lose all of those subsidies and all those cost sharings. So if you have health insurance from current work and your employer has 20 or more employees, so this is your current work or your spouse's current work. If you have health insurance from your spouse's current work, your current work, and that employer has 20 or more employees, then that's considered creditable coverage, and you do not have to sign up for Part B. You can save the $185, $202.90. And then once you stop receiving health insurance from current work, you have what's called a special enrollment period. So if you go onto my website, I've got a website, mygovexpert.com. It explains a lot of things original Social Security and Medicare websites do, but I think it explains it in English rather than bureaucratic ease. So you've got enrollment periods. And so let's say you refused Part B and Part D when you were 65 years old because you had health insurance from work, you're going to continue to work. And then you turn 70, 75, 85, who cares? Doesn't matter. Then you lose health insurance from work. And within 8 months, you technically have 8 months. I don't recommend waiting 8 months, but technically you do have 8 months to sign up for Part B to avoid the penalties. But you know what happens when you don't have health insurance for 8 months, right? That's usually when it happens, when you fall or somebody runs into you. So probably about 2 or 3 months before you know you're going to lose health insurance from work, you get this special enrollment period. There's a couple of forms that you need. There's the 40B and the 564. You fill these two forms out. You submit them. One of those you take to your employer. Employer fills it out and says, yeah. This person has had health insurance from current work for the past 5, 10, 15, 20 years, and there's no penalty whatsoever. So that's the special enrollment period. A lot of people miss this. If you sign up 10 years after 65, 75, 85, and you've worked for 2 or 3 different employers, you have to make sure you fill all those gaps. So you have to make sure your employer, you have to go to all those employers that you had health insurance from, 1, 2, 3, 4, and have them fill out a separate form. So all of those periods are covered. You got a lot of people that says, well, I filled out the form and I still get a 10% or 20% penalty. And it's like, okay, well, have you worked for the same place and you turned 65? Oh, no, I just filled out the very last one. I just sent it to my most recent work. Yeah, well, you missed a couple of years there, and therefore that's why you get the penalty. So they have to go back and get that fixed, because that penalty, again, will last forever. It's different than IRMA, we'll talk about here in a little bit. Okay, so that's creditable coverage. As I mentioned, the VA is not creditable coverage. A lot of people out there, veterans out there, that you're using the Veterans Administration's Veteran Affairs local VA clinic, whatever the case may be, and they want to avoid having to pay the $185. And I understand that. You're like, well, I've got the VA. I'm happy with the VA. I get all my health care there. It's, basically free. Why do I want, Part B? I've already got Part A because I had to sign up for that. I don't want Part B. There's a way to get out of that. I'll talk about a few ways to get out of paying for Part B if you're in those particular situations. There's called the Medicare Savings Plan and also the Part B Give Back, which I'll talk about here in a little bit. Same thing of those people. There's a lot of people immigrating back overseas, expats living overseas, cheaper to live on Social Security if you're only making, $1,000, $2,000 a month from Social Security. A lot of people decide, well, it's cheaper to live overseas, so they go overseas and they want to cancel their Medicare. Same thing with the VA. If you don't want to sign up for Part B, there's nothing, again, veterans, nothing is mandatory in this life. But if you change your mind later, whether you don't sign up because of the VA or you don't sign up because you're living overseas, and then you change your mind later because you want a second opinion, or the VA clinic is, the customer service has gone down. They're looking at cutting thousands of staff from VA clinics throughout the country. So, a year, 2 years, 3 years from now, you might not be as happy with the VA now as you are now. If you're living overseas, you might get sick or homesick, or the political situation in that particular country turns bad, and then you want to come back to the United States, you're going to get a penalty. 10% for every 12 months you didn't have Part B, and then Part D penalty as well. If you're living overseas, there's one exception on that. There are some countries that have a national health care. Best to check with that particular the American embassy in that particular country or the consulate in that particular country to see whether the national health care in that particular country is covered, is creditable coverage. Some are, but most aren't. So you definitely need to check that out. Okay, what if you want to get out of paying for your Medicare, the $185, $202.90, whatever the case may be? What if you just can't afford it? Then there is a plan, there's called Medicare Savings Plan. It's through Medicaid and whatever they call Medicaid in your state, the Medi-Cal, Access, Denali Care, there's a whole bunch of names, but it's all Medicaid. If you or someone you know are having a hard time paying for the Part B premium and are struggling across the board, have them apply for Medicaid. It's going to be tough going forward because the one big beautiful bill, in order to pay for trillions of dollars of tax breaks for the rich, people on Medicaid, people that are struggling are going to, they're going to struggle even more going forward. About $1 trillion is being cut out of that particular budget. But if you apply and you get approved at the higher levels, there's different levels of Medicaid, then the state will pay for your Medicare Part B premium and also take care of your Part D. And there's all kinds of different savings in terms of, covering co-insurance and co-payments and stuff like that. So it's called the Medicare Savings Plan or program. So you just contact your state Medicaid office and apply. And if they approve it, then you say, hey, I'm on Medicare, by the way. Are y'all going to pay my Medicare? And they'll tell you one way or the other. It does take a little bit of time. The previous administration on the Inflation Reduction Act, they passed a law that said we're going to make this easier for those people to apply for that program. The One Big Beautiful Bill decided we don't want to make it easier, and they delayed making it easier for 10 years. So it's going to be difficult to apply for that program. And so you might have to pay for if Medicaid says, okay, yeah, we're going to go ahead and pay starting this month. It might take a month or 2 months or 3 months. But if everything works out correctly, then they'll reimburse the $185 or whatever you paid for those 2 or 3 months while they were working through this new nightmare system they have. So that is one option for those, for you. If you're watching my channel, if you're new to my channel, this is what we do here. Hopefully you're listening to this for you to see if this is something that you can use to make your life easier. But just as important, everybody else around you. So please like, share, subscribe, and all that kind of good stuff. Teach these algorithms that this is important information. A lot of people are out there struggling. So reach out to someone that you know. They might know someone that can use this information. Okay, there's another way you can get out of paying the Part B. It's called the Medicare Advantage Part B Give Back. So those are particularly Medicare Advantage plans, and depending if there's one available in your area, then it, as the name implies, it pays for part of your Part B. $50, $75, $100, $185, $202.90. Has anybody received I know a lot of people in my community have got the Part B give back. It really depends what's available in your area. Is anybody anywhere in the country for 2026, the Part B give back, is it going to pay the entire $202.90? Let me know in the comments there. And also let me know how it's working throughout the country in terms of applying for Medicaid. One of our other websites, we have 2 websites. One of them is the mygovexpert.com, and that's where y'all go in there to get information, all things Social Security, disability, survivor benefits, spouse benefits, Medicare, Medicaid. But it's also, we have a discussion group website, 24help.org, where you can go in there and help each other out, get help from each other. So there's one on Medicaid here, a Medicaid discussion group. So join that group and let us know what we're looking at for Medicaid. Again, there's about $1 trillion that are going to be cut out of the budget nationally, and each state is going to get hundreds of billions of dollars, billions of dollars cut out of their budget. So they're going to either have to raise taxes on everybody if they want to keep people, covered with health insurance, or they're going to start kicking people off health insurance or making it so difficult, putting up so many roadblocks. Even if you are eligible, you're going to get kicked off just by, collateral damage, as the military says. So let us know how that's going. Okay, so the Part B give back. You apply through a Medicare Advantage plan. And remember, we are in the Medicare annual enrollment period right now. Medicare, the whole thing is crazy complicated. But from October 15th to December 7th, you're in the Medicare annual enrollment period. So if you have a Medicare Advantage plan, Part D, if you're looking to switch and go back to original Medicare and get a Medicare supplement plan, those are some of the things you can do right now up until December 7th. So if you need help, you can reach out to our sponsor, Chapter Medicare, our partner there. Just make sure you're prepared. So you make sure you find the right plan for you. Have your current plan so you can compare. Any doctors or clinics that you definitely have to keep provided, covered. Your prescriptions, a pharmacy, if you want to use a particular pharmacy, or have your priorities. Do you need more dental, vision, hearing, and prices? A lot of these are 0 premium per month. And again, this is same type of thing. That doesn't make it free. It's illegal to call these things free, because they're not free. Because number one, you paid for it by paying the $185, and you paid for it by taxes. But there's also prices. If you go to the hospital, it might be $100 a night, one plan. Another plan might be $200 a night. If you get an MRI, one plan might be $50. Another one might be $300. So check out the prices as well. And persistence. One of the problems with Medicare Advantage plans is they have prior authorizations and networks. So there's a lot of bureaucratic hurdles in those, and you just have to fight. And that's why we chose Chapter Medicare, because they fight with you. So if you choose Chapter Medicare and if you have an issue in January, February, March, April, December, you call them up and say, hey, I got this prioritization. Doctor says I need it. Can you help? I lost my doctor. Is there anybody that you can help me with finding a new doctor or specialist to do this, that, and the other? And they help you out. So definitely reach out to them. And full disclosure, they support our channel and all the free websites, all the free goodies that we have. All right. So those are called Medicare Advantage Part B Give Back. Okay. And then there's IRMA, Income Related Monthly Adjustment Amount. So those are for high wage earners based on 2 years ago. And you're like, well, I got an IRMA and I'm not a high wage earner. I just sold my house. Yeah, unfortunately, that counts. Congress didn't make an exception for that one. So it's based on your earnings, your income from 2 years ago. And this is only for 12 months. It's not, you're not going to, if you're have to pay an extra $100, $200, $300 for your Part B, and you also have to pay extra for your Part D. If you're having to pay extra for that because of your income from 2 years ago, that's only for 12 months. They reevaluate that every 12 months. And then for 2027, if you made high income in 2025, so it's reevaluated every year. Did I say month? Every year. But you can fight that as well. It's if you had a high income 2 years ago and you just got a letter that says, okay, we're going to charge you an extra $200 a month for your Medicare Part B, you can fight it. It's an SSA 44. And let me put up on my website here, SSA 44, and it's called a life-changing event. So you click on Medicare there and you go into the IRMA tab. Again, this is my website, your website, mygovexpert.com, and it tells you all about IRMA and unfortunately the thing about selling a house, and it gives you all of the information about IRMA. Okay. So if you have a life-changing event, sure, you made a lot of money 2 years ago, but you've since stopped working or reduced your work, then that's called a life-changing event, and you can fight that. So, all right. So those are all the situations on whether you should pay Medicare. And let's see, we've got a question here. Where did it go? Disabled son, SSDI DAC from dad's retirement benefits, and I'll explain what that is. Let me see if I can find the actual question in here so you can see the actual question. I'm not seeing the question. Okay, I'll just go ahead and read it here. All right. Just got Medicare card eligible. So a DAC is a disabled adult child. So Brother Ford 462, who also donated $10 to the cause, we appreciate it. You're too awesome. Has a disabled son and a DAC. A DAC is a disabled adult child, someone that's receiving benefits off of a parent or a grandparent's record, with exceptions, that is either receiving retirement benefits, disabled, or deceased. Okay. So this son is receiving benefits from the dad's record because the dad is receiving retirement benefits. And the child, the son, has been receiving SSDI for 2 years and therefore just got the Medicare card, which is going to, is soon to get a Medicare card. Already got it. So Medicare starts March of 2026. And the question is, he is on Medi-Cal, which is Medicaid in California. Medi-Cal. Yeah. Anyway, can he keep it or do we have to pay for Part B? He lives in a group home. Next steps. Okay. So this one's a little tricky. Yeah, you could definitely keep it. Reach out to Medi-Cal and get that Medicare savings plan, the program. And if he's in the higher levels of Medi-Cal, Medicaid, which it sounds like he probably is, it's based on income and resources in the state, eligibility requirements and everything. But if he's on the higher levels, QMB, Slim B, QI, it's called, then they will pay for his Part B premium, $185, $202.90. Okay. Here's one thing to be careful of. So he will have Medicare and Medicaid. So he is what's called dual eligible. So when you're dual eligible, There is another program you can get in most states. Well, you can't get a Medicare supplement plan, one of those plan NGs or Fs, or if you're on Medicare or Medicaid, you can't get a Medicare supplement plan. But sometimes people will try to sell you a Medicare Advantage plan, and it might be good, but it might not be. Here's what you need to watch out for. Because he's living in a group home, reach out to that group home and say, hey, he's getting Medicare starting in March, so he'll be dual eligible. I've heard about these Medicare Advantage plans that in our area gives him another $100 or $200 or $300 for, over the counter food or different stuff. He could really use that extra money in there, whatever the case may be. Depends on the particular situation, living situation. But be careful on that, because the group home might say, oh, no, yeah, don't sign up for that, because then we will have to go through that Medicare Advantage plan, and it'll cause a whole bunch of nightmares. Most of those group home type things like to bill Medicare and Medicaid directly. So you've got, maybe, depending on what's available in your area, some extra benefits, some extra money that's available in the Medicare Advantage plan, but don't, mess up your particular situation, for $100 a month. Don't mess up, what you got going that hopefully is going well for him. So, but yeah, in terms of Medicare, Medicaid, number one thing is to reach out to Medicaid and say, hey, by the way, he's getting Medicare. And they'll say, yep, no problem. We probably already know about it.